Premature ejaculation is one of the most common male sexual complaints, but also one of the most misunderstood. A lot of men think it means there is something fundamentally wrong with them, or that it automatically means weakness, lack of control, or permanent sexual dysfunction. In reality, premature ejaculation is a recognized sexual health condition, and it can be influenced by psychological, relational, and biological factors all at the same time. The American Urological Association and the Sexual Medicine Society of North America describe premature ejaculation as a common male sexual dysfunction, and major sexual medicine references distinguish between lifelong forms, which have been present since a man became sexually active, and acquired forms, which begin later after a period of previously typical function. That distinction matters because not every case has the same cause. Some men have always had difficulty delaying ejaculation. Others notice the problem appearing later, often during periods of stress, erectile difficulties, relationship tension, or changes in health. The International Society for Sexual Medicine notes that the exact cause of premature ejaculation is not fully known, and that in most men, no single biological factor has been proven to explain the condition by itself. At the same time, authoritative sources consistently point to a mix of psychological and physical contributors. So in this video, we are going to answer two very important questions. What are the most common causes of premature ejaculation, and what kinds of patterns may quietly make the problem worse over time? Let's start with one of the most common factors: performance anxiety. Anxiety is one of the clearest and most frequent contributors to premature ejaculation. NHS guidance lists anxiety about sexual performance, stress, depression, and relationship problems among common causes, and Mayo Clinic also includes emotional and mental factors in the overall picture. When a man becomes overly focused on lasting longer, his attention often shifts away from pleasure, connection, and rhythm, and toward monitoring, pressure, and fear of failure. That tends to make the sexual response less calm, less flexible, and harder to regulate. One bad experience can lead to anticipation, and anticipation can make the next encounter feel even more pressured. Once that cycle begins, the problem is no longer just about ejaculation. It becomes about self-surveillance, tension, and the fear of repeating the same outcome. The second common cause is the interaction between premature ejaculation and erectile dysfunction. This is a very important connection because the two conditions often overlap. The AUA SMSNA guideline and broader sexual medicine literature recognize that erectile dysfunction and premature ejaculation commonly coexist. Mayo Clinic also states that erectile dysfunction is a risk factor for premature ejaculation, partly because fear of losing an erection may lead a man to rush through sex, consciously or unconsciously. This creates a pattern many men never clearly identify. They are not ejaculating quickly only because they are too sensitive. Sometimes they are hurrying because part of their mind is trying to finish before the erection fades. In those cases, treating only the ejaculation problem without understanding the erection problem may miss the deeper issue. A third common cause involves stress, mood, and overall mental load. Sexual function is not isolated from the rest of life. If a man is overwhelmed, exhausted, preoccupied, or emotionally strained, that can affect arousal control. NHS specifically lists depression and stress as common causes of premature ejaculation. Stress does not always shut sex down completely. Sometimes it changes the way arousal moves through the body. It can make the response feel more rushed, less grounded, and harder to slow down. Men often assume sexual problems must come only from hormones or blood flow, but the nervous system is deeply involved, and a system that is constantly on edge often performs less predictably. A fourth common cause is relationship tension or poor sexual communication. NHS also includes relationship problems among common causes of premature ejaculation. This makes sense clinically. Sex does not happen in a vacuum. If there is resentment, emotional distance, fear of disappointing a partner, poor communication, or repeated negative experiences, the sexual encounter may become loaded with pressure instead of responsiveness. That often reduces the ability to relax and regulate arousal. In some men, the issue is not simply physical sensitivity. It is the combination of pressure, lack of communication, and a relationship environment where sex feels like a test instead of an experience. A fifth piece of the picture is that lifelong and acquired premature ejaculation are not always the same phenomenon. The ISSM Quick Guide explains that lifelong premature ejaculation typically begins from a man's first sexual experiences, while acquired premature ejaculation appears later. That distinction matters because acquired cases are more likely to push you to ask, what changed? Did anxiety increase? Did erection quality decline? Did health worsen? Did relationship conflict appear? Did medications change? The AUA SMSNA guideline notes that disorders of ejaculation can be associated with comorbid conditions and medications. So when a man suddenly develops premature ejaculation after years of different sexual functioning, the question should not be only, how do I force more control? The better question is, what new factor may be driving this change? Now let's talk about what can make the problem worse. The first thing that can worsen premature ejaculation is repeated panic about the timing itself. The more a man fixates on the stopwatch in his head, the more likely he is to create a feedback loop of tension and fast escalation. Anxiety narrows attention. It also makes the body less relaxed during sex. In that state, men often lose the ability to pace themselves naturally. What begins as concern becomes acceleration. That is why performance anxiety is not just a cause, it is also an amplifier. The second thing that can worsen the problem is ignoring erectile difficulties. As mentioned earlier, erectile dysfunction and premature ejaculation often reinforce each other. A man may become more likely to rush if he is worried about losing firmness, and repeated rushing can increase anxiety even more. Mayo Clinic explicitly notes that fear of losing an erection may contribute to premature ejaculation. So one of the biggest mistakes is treating ejaculation as if it exists separately from erection quality. In many men, the two problems form a cycle. The third thing that can worsen the problem is untreated stress, depression, or chronic mental strain. A sexual system that is constantly operating under emotional load often becomes less stable. The NHS source is very direct that depression and stress can be part of the cause. If those issues remain untreated, the sexual symptom may persist or worsen. Many men focus only on the bedroom and ignore the rest of the week. Poor sleep, emotional overload, tension, and constant pressure. But the body carries all of that into sex. The fourth thing that can worsen premature ejaculation is relationship silence. If a couple stops talking openly, the problem often becomes heavier than it needs to be. Pressure increases, shame increases, avoidance increases. Even when the original cause is partly biological or anxiety-based, silence can turn a manageable issue into a relationship wound. NHS and Mayo Clinic both point to relationship problems and emotional strain as relevant factors. So while communication is not a magical cure, poor communication can absolutely make things worse. The fifth thing that can worsen the problem is self-diagnosing too simplistically. Some men assume it is just sensitivity. Others assume it must be permanent. Others blame one factor, like testosterone, without evidence. But sexual medicine guidance shows that premature ejaculation has multiple contributors and often overlaps with other conditions, especially erectile dysfunction. When the explanation is reduced to one simplistic idea, the real pattern may be missed. That often delays proper treatment and keeps the cycle going. Another point worth understanding is that occasional fast ejaculation does not automatically mean clinical premature ejaculation. Sexual function varies. Stressful periods, new relationships, long gaps between sexual activity, or temporary anxiety can all affect timing. That is one reason guidelines emphasize persistent patterns, distress, and loss of control rather than a single isolated episode. This matters because many men create unnecessary fear from occasional variation, and that fear itself can then become part of the problem. So what is the practical message here? Premature ejaculation is not always caused by one thing. Common contributors include performance anxiety, erectile dysfunction, stress, depression, and relationship problems. It may be lifelong in some men and acquired later in others. It can also become worse when anxiety builds, when erectile issues are ignored, when emotional strain stays untreated, and when couples stop communicating. That is why the smartest approach is not shame and not guesswork. It is pattern recognition. If the issue has always been present, that points one way. If it appeared later, ask what changed. If erections have also become less reliable, pay attention to that. If stress and pressure are rising, that matters. If the relationship is strained, that matters too. The body usually gives signals before a sexual problem becomes impossible to ignore. Premature ejaculation may be one of those signals. Sometimes it is mainly anxiety. Sometimes it is partly tied to erectile dysfunction. Sometimes it is being worsened by stress and silence more than a man realizes. The goal is not panic. The goal is to stop treating the symptom as random and start looking at the pattern behind it.